Assalamu alaikum, dear students. This is the second part of the previous lecture. We started on the electrocardiogram. So let's start from the how to read the ECG paper. So ECG paper is basically a white paper on which there are red grid lines, which are there are small boxes, large boxes, and through these large boxes we can calculate the heart rate as well from two methods, which we will discuss in the upcoming slide. So in this ECG paper, in these boxes, one small box that represent 0.04 seconds of duration, or it is equal, one small box is equal to 1 millimeter. Similarly, one large box, which is made up five small boxes, that is equal to 5 millimeter, or that represent zero point 0.2 seconds of duration. And if we similarly five large box, right, which mean 25 small boxes, that is equal to 1 second or 25 millimeter. 30 large box, that is equal to 6 seconds, and these 30 large box will be used in the heart rate calculation, which is the second method, and that will be discussed in the upcoming slide. And then the 300 large box, that is equal to 1 minute. The duration of peer interval is almost 0.2 second, and that is equal to one big box, while the duration of QRS complex is 0.12 second. One small box is equal to 0.04 second. So if we multiply this by 3, that will equal to 0.12. So there's three small boxes that will be equal to 0.12 second, and that is actually the duration of the QRS complex in the normal ECG. This is the ECG paper. This is the line. These are the grid lines. This one small square, it is the small box. And then the board lines, this is the large box. And that is 1, 2, 3, 4, and 5. These are 5 large boxes. And that is equal to 1 second or 1000 millisecond. The duration of one large box is 0.2 second. One small box that represent 1 mm, and 5 small boxes that represent 5 mm. So one large box, if we count in them in the horizontally, they are also 5 in number, and if we count them vertically, they are also the same 5 in number, and that is one large box is equal to 0.2 second or 5 mm, or that one large box is also equal to 0.5 millivolt, or two large boxes, or 10 small boxes vertically, that is equal to 1 millivolt. This is the KVRS, this is the P wave, this is the PQ segment, this is the ST segment. These two are the segment. Now the summary, that is there is generation of that impulse at the SA node, and then there is atrial depolarization. After that, there is slight delay in the AV node, and then there is ventricular depolarization through the traveling of the impulse from the SA node to the bundle office, and then to the right and left bundles, and then to the Purkinje fibers at the end, and to ventricular depolarization, and then up to the normal sinus rhythm. P wave precedes every QRS complex, and every P wave is in turn succeeded by a QRS complex. This occurs within an interval of 0.2 second, which is equal to one large box or 5 small boxes, as determined by the PR interval. The QRS complex occur within a range of 0.08 to 0.10 second, or that equal to 0.12 second, when equal to 3 small boxes, indicating that ventricular impulse conduction and depolarization is occurring in the normal interval. The positivity reflected T wave indicates the normal ventricular repolarization. Now this is the one method through which we can calculate the heart rate. This image that shows the count of method, which is also called as the 300 rule method for estimating the heart rate from an ECG using the distance between the two R waves, two consecutive R waves. This is one R wave, this is R wave, R wave, this is R wave. So the distance, counting the distance between two R waves, that is used to calculate the heart rate. We can see here, this is actually the heart rate is on the large box, and then counting the next R is on which large box. Mean, suppose if the question someone asks you that how the count of method works, so the answer is each large box on the ECG paper that represent 0.2 second and 5 small boxes that make up to 1 second. This is one large box. This is the second, third, fourth, fifth. These are almost 31 large boxes if we count them in the horizontally. So how we can estimate the heart rate from this 300 method from the ECG? So start at one R wave that falls on a heavy line, or we can say that the bold vertical like this one. Suppose this one is just over that bold line, this is the R. Then count the number of large boxes after this one till the next QR. So if we count the large, this is the one, this is the second, this is the third, and this is the fourth one. So these the next QR is on the fifth board line, and there are four boxes. And if the next R is on the next board line, that is the heart rate is equal to 300. And if it is on the second line, that is the 150. If it is on the third, that is equal to 100. And this is if it is near or equal to that. And the fourth one, that the heart rate will be equal to 75. If it is just a small box away from the next board line, so that may be less than 75, almost 72, 73. And if it is just beyond this board line, after this line, so that may be the that may be more than less than 75. And if it is just one small box away from that board line, then it may be between 100 and 75. That may be 80, that may be 78, there may be 82, and so on. So one box after the QRS, which is just falling on this right hand, that is equal to 300 beat per minute. Two boxes that equal to 150 beat per minute, and then the three that is equal to 100 beat per minute, and four boxes this that equal to 75, and five boxes that equal to 60 beat per minute, and six boxes that equal to 50 beats per minute. If we took it this image, so example in this image, if we start the R wave which land on this box, right? So according to the sequence, this is 1, 2, 3, and 4. This is on the fourth box, so that is almost equal to 75 beats per minute. If this next QR is this R wave was here, then the heart rate was 60, and so on. The next method, which is known as the 6-second method for estimating the heart rate on ECG. In this method, we will count the 30 large boxes. The 6-second method is a simple way to estimate the heart rate, especially useful for irregular rhythms like the atrial fibrillation, which is, as we can see here in this, there is some again irregular rhythm we can see here. So this 6-second method is used for such condition when there is arrhythmia. And how we can use this method? So 6-second method for estimating the heart rate is we can calculate heart rate in this image. Identify a 6-second strip, and why a 6-second strip mean the 30 large boxes. This is 1, 2, 3, and 4, and if we count them up to this one, so they will equal to the 30 large box, because uh, 5 large boxes that equal to 1 second. So how many boxes will be required to reach the 6 seconds? So obviously 30. So 1 second equal to 5 boxes, large boxes, and 6 second equal to 30 large boxes. Up to count after. So then after the counting the 30 large boxes, then we will count that how many R waves are there present in the 6-second strip. Then multiplied that number by 10 to estimate the heart rate in beats per minute. So the formula for the estimation of the heart rate is the number of R waves in 6 seconds multiplied by 10. If we took this ECG, so from 1, this is the 30, this is a 6-second strip. And if we count the number of R waves in this image, so they are 1, 2, 3, 4, 5, 6, and 7. And then we will multiply the 7 by 10. So the heart rate will be equal to 70. Sinus bradycardia. Sinus is a sinus rhythm which occurring at a rate less than 60 beats per minute. This rhythm may significantly reduce the cardiac output, causing the hemodynamic compromise manifested by the hypotension or symptoms such as the dizziness, lightheadedness, or the syncope. So again, use the 6-second strip method. This is again the 6-second strip. These up to here, these are the 30 boxes. And if we count the number of R waves in this image, which is a 30 large boxes, so that is R wave 1, 2, 3, 4, and 5. And then there are 5 R waves. You will multiply this 5, which will equal to 50 beats per minute, which is less than 60. So that's why this is the sinus bradycardia. The sinus tachycardia, when sinus rhythm occurring at a rate greater than beats per minute, when the heart rate is more than 100 beats per minute at rest, so that will be called as the tachycardia. And sinus tachycardia increases myocardial oxygen demand and the workload on the heart. This may initiate or exacerbate ischemia in the presence of the coronary artery disease. So again, this is a 30 large box strip or the 6-second strip. And if we count on this 630 box is the number of R waves, so that will be 1, 2, 3, and 4, 5, 6, 7, 8, 9, 10, 11, 12, and 13. So there are 13 R waves in this 30 large box of second strip. So we will multiply this 13 by 10, and that 13 multiplied by 10 will be equal to 130, which is more than 100. So we can see this from this image that the person is having tachycardia. This is sinus tachycardia. Thank you so much to all of you. Have a nice day.